To get back on next session, I would like to introduce about our resource person. It gives me great pleasure to introduce Dr. Gnaneswari Guru, a distinguished academician and researcher with over 2 decades of rich experience across reputed institutions. She holds a doctorate in cognitive science and machine learning with her research expertise focused on deep learning. Dr. Gnaneswari currently serves as an associate professor in the Department of Computer Application and CMRIT Institute of Technology, where she also heads the Center of Excellence for Application Development. Beyond academia, she is the co-founder and director of Variation Consulting Service and Solution Private Limited, reflecting her dynamic blend of academic and industry excellence. A passionate researcher, Dr. Gnaneswari has authored over 25 research publications in the reputed journals and conferences, and she is presently pursuing her postdoctoral fellowship at Srinivasa University, Mangaluru. Her commitment to innovation, learning, and impactful research continues to inspire both students and peers alike. Let us all warmly welcome Dr. Gnaneswari Guru and look forward to her insightful session today. Now I request Professor Gnaneswari ma'am to take over the session.
Thank you so much, ma'am, for this introduction. I'm really humbled. Thank you, everybody, for joining this session. I would like to thank Ilongo sir and Rajalakshmi ma'am for giving me this opportunity. Thank you, sir and ma'am. So we will now directly go into the session.
Yes, ma'am.
So, participant, kindly let me know if I'm muted or is there any problem in you seeing the PPT or hearing to the audio. Please let me know.
Okay. Visible now.
Yeah. Right. So we have been listening to so many sessions in generative AI, especially for healthcare. So the point I would like to start with is, see, the AI in healthcare is already established. So we would have seen a lot of papers, we have gone through a lot of research work already happening in AI for healthcare. Say like predictions, right? Like classifications, whether it is a tumor or not. So these kind of problems already we have seen. So that is AI in healthcare. Gen AI in healthcare is a niche technology which is evolving and it has a lot of scope in the future. So this is the technology that we are going to speak about today. So some of the topics maybe you are known to those topics, but we will have a different perspective in how we are going to look at it. So when I'm starting my session, I would like to start with what is Gen AI itself. So because I would like to establish that there is a huge difference between AI and Gen AI, and AI for healthcare is what we would have already explored. Gen AI for healthcare is a new field which is upcoming, and we will be exploring more on the generative AI for healthcare today. Right. So just 2 3 slides of what is Gen AI. Let us try to summarize it to ourselves and try to do a brainstorming of what is Gen AI all about. Right. So Gen AI here is a transformative approach, which means that there is data which is existing. We are trying to create similar data from whatever is existing. So what is that we are trying to do is we are trying to create new data. So this is not the analysis which we will be doing from the existing data, the historical data, but we have to first learn the patterns from the existing data, and we are trying to create new data, right? Like a copy of that data, and we are trying to copy as much as accurately as possible. So that is what we are trying to do in AI, whether it is a image generation or a text generation, or say let's say music generation, or maybe in healthcare also. So that's a niche which we have to now discuss. Right. So the fundamental and foundation of the Gen AI is nothing but your deep learning. Right. So deep learning models are going to be your foundation, where neural networks forms the basic part of it, and you have CNN, RNN models, which is also going to be the foundational architectures or the algorithms for generative AI. Right. So in that we are going to just touch upon on a few algorithms. So will be discussing about GANs. Right. So generative adversarial networks. We'll also be touching upon on variational autoencoders. So these are some of the machine learning algorithms which is basically used for generative AI, and we are going to explore how those algorithms can be extended to healthcare. Right. That's what we are going to discuss. So it's going to be a kind of a discussion on specifically on healthcare, generative AI. So any generative AI model, whether it is healthcare or any other domain, basically is going to do this thing. There is a huge, massive data set which is available to us. So much of data is around us. We are trying to find patterns from the data. We are going to find and crack complex relationships which is present in those kind of data. So that is what we are going to be doing in Gen AI. Now, so this is general information which all of us already know. But what I would like you to do is, I would like you to relate it to healthcare. Now think about, okay, this is already existing. So this is already what we have been doing. How can I do that same thing for this particular domain of your healthcare domain? So that is what I would like to brainstorm. That is why I'm keeping these, these basic information about generation also. Say image generation is a basic information. We have been using all this chat GPT, for example, Gemini, the Nano Banana is very popular now creating images. So just for a fun fact, I have also recreated and no, generated my images like however I wanted it to my imagination. Yes, image generation happens in Gen AI. We already have established and it working so well. It is doing so well. How are we going to extend this to healthcare? In healthcare, you may think about, so I'm telling you brainstorm and think about where in healthcare can I use this technology, right? So when you think about that, when you collaborate this and think about where I can use in healthcare, you will be able to come up with a lot of no applications of Gen AI, right? Image generation especially. So let me tell you where exactly it is used in medicine today is, for example, you have all these MRI scans, CT scans and things like that going on, right? So where you can use this Gen AI, so especially the image generation part of the AI can be used, right? So this is what we are going to explore today, right? So where in exactly and how can I generate an image? So the MRI scan, how can I generate, or what is the purpose of me generating it? So actually the purpose of you generating this, so MRI scan, is that sometimes no, you don't get enough data for some rare diseases. You only have handful of data, so you will be able to use that technology, right? That's one way of using it. So exactly where? ಅಮ್ಮ ಆಮೇಲೆ ಮಾಡ್ತೀರಮ್ಮ, ಸೆಷನ್ ಇದೆ, ಆಮೇಲೆ ಮಾಡಿಮ್ಮ, ಹಾಫ್ ಅನ್ ಅವರ್ ಮೇಲೆ. Right. So where exactly are you going to use it? Okay. So that is what we are going to explore. See, when I'm going to take an MRI scan of myself, right? I have a problem, let us say a health problem, a lung disease. So when I am exposed to MRI, it's exposed to radiation, right? So sometimes you may not allow the patient to spend more time in the MRI scans and give them radiation. So what is that suggested thing is, whatever MRI could generate in a little time can be enhanced using Gen AI. So that is one application where the image may not be proper, it may not be full. So you can use Gen AI, give the historical data, and it will be able to give you an enhanced picture of whatever MRI you have taken. This is one very interesting application. Another very interesting application of generating image in Gen AI is that, so I would be having, I would have done say an MRI scan, but doctor would want a CT scan. So they say CT scan gives you a more clarity on the nerves, the muscles and nerves, right? So they may want you to do another CT. Again, there is exposure. So now there is also work going on can I have the MRI scan and can I recreate my CT scan image? So this is again a huge revolution that is happening in Gen AI, especially in image generation. So now we are comparing we already know the image generation concept which is there today, and we are trying to use the same concept and we are trying to extend it to healthcare domain. That's what we are exactly doing today. So this is one about image generation. Text generation, of course. So we already are exploring into chat GPT and lot of Gemini and lot of tools we are using today. So every day there is talk about a new tool which is used for research, a new tool used for teaching, and so on and so forth. So transforming communication. So Gen AI, as of now, is able to do content creation, creative writing, translation from one language to other, and chatbots, of course, customer support. Now, all these are listed in front of us. Now, what is that we supposed to do is, we are supposed to brainstorm and think, how can I use this in healthcare? Say, for example, there could be a chatbot specific for your health problems, right? Could be a pediatric chat, right? Available. Could be a mental health chatbot, which can be specific to uh, patients, right? So again, you can think of that. Again, code generation is a huge area which has been developed, software development. So here we can again think about code generation for a particular disease, right? So here drug discovery and all those things are going to come into picture. Can I no, extend my program into various say modules, so where I can specifically touch upon on these domains. So that is again one thing which is can be done in text generation. So again, there are reports which we have, and we take, no, they have to type the reports. Doctors have to type the report. Transcriptions has to be done by them. Right now, can I just show the scan, and will my system be able to generate the report for that? Right. So I have actually no. Done some kind of a research, and I have listed so many applications. So which can be image generation, could be text generation, Gen AI applications for healthcare. So I have listed that. We will discuss about that in the last slide, right? But still there is lot of scope for Gen AI applications, even for text generation. So where we are going to say talk about generating reports, right? So again, of course, music and audio, right? So again, we have to find, ways of using this audio generation in. So can I analyze the audio? Say there is an echocardiogram. Can I take the audio and analyze it? Right? Can I make a report out of it? Just the cardio will be there. I will only do the audio analysis, and I should be able to come up with a generate a report. Right? So will this report be trustworthy? Again, the question is, how can we trust this such a report? So we are all used to trusting medical professionals. So clinically, is it possible? Yeah, it can. As of now, it can actually be used as an aid for these medical practitioners. They will be able to conclude whatever conclusion they are going to come, right, to with this of this report. They will have more assurance. They'll also have somebody, a buddy, who is going to also help them in analysis. So this can be looked upon like that. So right. So again, there you can use. Right. So though we talk a lot about Gen AI and how we are going to do, trust issues are already there. Of course, there is another very big issue in any AI, not generative AI. In any AI, there are these ethical considerations which we have to hear out. Right. If say just in AI, if you have so much of ethical consideration, imagine in healthcare. Right. So imagine in AI in healthcare itself, there are a lot of ethical consideration which was discussed in some of our sessions also. Right. So that concerns are there. So when you say in healthcare, what concerns do we may have? So what is the how about the privacy of the patient? Right? How are we going to do that? How are you going to make it secured? Say for security especially, we have all these encryption of data, using those encrypted data where the patient ID or the patient information will not be revealed, because that is going to cause a very big threat. Right? So they can insurance companies may get an alert. Right? So because now today in generative AI, especially in personalized medicine, so what is the scenario now? I have my whole history, right, saved in my so under my name. Say for example, I am a patient of a particular hospital, and that hospital is maintaining now records. Digital record is being maintained. So from those digital records, I will be able to personalize my treatment plan. And also there is a study which says, so if I give my complete data, right, whatever is my health report, or what is the report today, so what is my blood sample look like, what are my scans going to look like, and doctors will be able to predict in next 20 years what kind of illness can I get. So that prediction is going to be available. So this information, if it is no this information is going to be open, right, the insurance companies will not be able to function the way they function today. Right? So there is a lot of ethical constraints. Not that everything we can happily keep saying AI is going to generate, okay, and do a lot of advancement in treatment plan. So simultaneously, so the technology is improving on one side, simultaneously it is going to be on other side. There is also a huge responsibility which is laid on our shoulders. Right? So especially Gen AI in healthcare has a huge responsibility, because we are trying to generate data. How trustworthy is the data? Can I no can I depend on that data and then devise a plan for my health? Right? So you use chat gpt, whatever you ask, sometimes you are not able to get the correct reply. So you tweak here and there, and you try to learn that prompt engineering, and then you apply queries accordingly. And even if there is a mistake, that is not going to be a big loss. But imagine in the healthcare domain, So it's going to be there cannot be mistakes. So we should be very sure. So until we are very sure, until there are policies in place, until there is responsibility to even with all the researchers, this domain is going to be very very sensitive domain, right? So what are the threats there? Synthetic content. So whatever we are going to generate here are all called as synthetic data. For example, synthetic MRIs, synthetic CT scans, synthetic X-rays, right? So we have a lot of synthetic data. And then there is also study which is happening simultaneously on how good is that synthetic generated data. I will show you some examples also. How good is the data which has been synthesized? So is this problem free? Right? No, there are so many papers which has been released saying that though we have generated data, though the data is very, very much similar to the existing data, but still there are some things in the data, right? Small details in the data which are missing, which could be very important, which you can come up with it could be a revelation, right? So you are missing that fact, right? That is one problem. The other problem is anomalies. So how much of anomalies are added, right? So for example, there is an eye retina where and there is a like a mirroring effect of the eye where there is two retina in that particular generated image. So it's a big flaw, right? So we also have to consider that. So these are all the consideration which we should have. These are all the ethical considerations. So ethics is going to be there is already a biased algorithm, we say. So what do you mean by biased algorithm is the algorithm a problem? No. So bias actually comes from the data that I have, right? See, for example, there is race, right? So whenever you try and generate an image of a maid, right? So the problem, this is a discussion, is a huge discussion, wherein the images generated are all belonging to a South African who is a maid. So what are we teaching our algorithms? Are we teaching that only, these African maids are, maids means them, right? That's a race, big bias in race. So similarly the bias in gender, right? There is a household thing, we want an image of somebody using a washing machine, it always will be a woman, right? So that is how biased the data is. It is not the algorithmic bias, it is the bias with the data. It converts to the algorithmic bias also, right? So that is one threat. So bias in algorithm, that is a very big threat which we have to we should try and eliminate it. So we have to normalize the data which we are going to pass to the system. Why? Because Gen AI has the capacity to amplify the existing bias. So there is a small bias, so which as humans we will be able to understand that though it has generated an image of an African maid, we understand that is a can be like it is like one of few of the maids could be them. Though as humans we understand, but systems don't understand that. They only take that for granted. So they say always amplify things, right? So that is one bias which is there. So another responsibility which we should be having is ethical practices across hospitals, right? So how responsible they are, how transparent they are. So already you take a report from one of the hospitals, and we always now even now do to cross verify again, take a similar report, only then we accept for say a big procedure like a surgery, right? We always take a second opinion, right? So how transparent are the hospitals? So how transparent are the hospitals in sharing the data with you, and how no responsible you are in using that particular data as a researcher. So these are all some of the concerns that we should also be addressing simultaneously as we speak about the technology. So this is one thing. Again, the intellectual property, of course, any AI who has done it is the biggest question. So we are giving assignment for students and we don't know how they generated. Most probably it looks like a AI generated content. And now we are also trying to diminish that line between the AI generated content and the human generated content. So we are doing a humanification of that content, and slowly we are trying to blur that line, and that has caused a big say a problem. Even now we see videos and now read articles where they talk about the most popular plagiarism software, the Turnitin, where it is not able to, now it is in a position where even the human generated content is showing us plagiarized content or AI generated content. So the more we come closer and trying to make things which is like as human as possible, this is the problem. So how are we going to reach out to this intellectual property rights, and how are we going to act responsible? So that is again another important thing which we have to think of. So balancing innovation and with responsibility is going to be a big challenge now. So today we should have proper policies. Policymakers should think about it. We should have proper policies and frameworks where do's and don'ts should be listed thoroughly. Right? So always any clinical trial, even clinical trials today have a lot of formalities which been followed, right? So when it comes to actual human testing, there is a lot of protocols which has to be followed. Same thing is what we are saying has to be in Gen AI also in healthcare. Right. So now we generally spoke about what is Gen AI and how can it be equated to a normal Gen AI can be equated to a Gen AI in healthcare. Right. Though it is a very small niche, as I keep telling you, AI in healthcare is a vast area, but whereas Gen AI's use in healthcare is a very niche area, but it is going to be revolutionizing the future. Right. It is happening as we speak. Right. That is happening as we speak. So I also hear from very elderly people who are not into academics, is AI true? Is it really happening? So I only can think of a dialogue from a movie called this Pirates of Caribbean. So where she says that I don't believe in ghost stories, but he says no, no you are already in one. So they don't believe in AI, whether AI is really happening, but we are already in one, whether we like it or not, right? And it is going to revolutionize the future. Right, the kind of content we read every day is very exciting. We are all excited to see that future which is in front of us, evolving in front of us. Right, so we are also going to be a part of it. So we should be proud of the fact that as researchers we will have the first hand information even before the prototype is going to be out there. Right, so we should really look forward to that. Okay, so generative AI now in healthcare, it is revolutionizing healthcare is an understatement, right? So so many things are happening. So what can all be done using Gen AI? Medical image enhancement. I spoke a lot about image enhancement, maybe the scans, the X-rays, and all these things. Apart from that, there is also these pathology, which is also there, the blood work, the molecular structure of, say, medicines. So in pharma, so many medical image enhancements can be possible. Patient care, right? So again, you can personalize, you cannot even say personalize, I would say hyper personalized care. So it's not about what is your x-ray, how does it look like, it's not about what is your MRI, how does it look like. We are going to have a collective, how is your lifestyle, right? So what is your medical history, what is your gene history, gene data, what is your genetic data speaks, right? What is your family history? So we are going to combine all that. Is not just personalization. I would like to say that it is hyper personalized care is given to the patients, where you have so much of data, where it will be easy for the physician, the medical practitioners to come to a decision, especially with the aid of Gen AI. Right. The third very important revolution that is happening in healthcare Gen AI is the disease diagnosis. Right. So you would have seen this article where they say that no, the cancer is supposed to, it's not same in every person. So in every person, every patient, the type of cancer and the cure for that cancer is going to be different. It is going to be case by case. So that's what we see now. Disease diagnosis, now we can say that I will have a system wherein it will be able to exactly precisely find out what type of disease, so diagnosing that particular type of disease, and use a combination of medicines that would cure. Right, so they say it is revolutionizing the time that we would have taken otherwise for this disease diagnosis and drug discovery is reduced to, I don't know, it's like reduced to millionth time or so. Right, it would have taken years, now we are able to do it in 15 minutes is what I hear. Right, so this disease diagnosis and drug discovery, having this permutation and combination, instead of you trying it on patients in a permutation combination basis on whether this drug works for that particular disease, so it is going to take years for you to come up with the actual output. But wherein if you allow the AI, Gen AI, to do that, right, so it would be able to do it in minutes. Right, so that is going to be a huge breakthrough in Gen AI area. Right, the next of course is medical education. Like any other education, moreover in medical education, even we love to see those animation videos, right? How, what is happening inside, how does the heart function, right? What actually is happening. So for medical education, generating these, okay, from real time images, generating these kind of animated videos and images to understand the working of the human body is going to be a huge breakthrough again. So again, medical education. So they'll be able to see the molecular structure. Visualization has actually improved so much that you'll be able to zoom into one particular molecule and see how it acts, right, when it is given to a patient. So these kind of visualizations are also possible. So medical education is again, going to see a breakthrough, right? Of course, personalized medicine. So I'm saying that personalized medicine, where you have the historical data, the genetic data, the lifestyle modification, where do we live? Okay, what kind of food do you eat? Right? What is the environment you have? So what is the temperature of your area? So everything together is going to decide. So such is going to be the personalized care that we are going to get. Right? So Gen AI, I would say that you need no you need proper advanced ML algorithms, right? Not ML, DL, especially deep learning algorithms, which we already have. We have proper no say hardware to support that. We have these GPU systems, so we are at a right time where we can explore all these revolutions happening, right? Synthetic medical imaging, right? Again, as I told you, reconstructing MRI is one, and because of that, what is that we are no gaining is, one, we are going to no reduce the time, reduce the exposure, or exposure to radiation, also sometimes reducing the invasive procedures, right? So this is really a breakthrough in healthcare, because see, not everything needs to be an invasive procedure. You don't have to go and poke on your brain to understand the functioning of a brain. You can just tap into the signals you get, right? So that again is a non invasive procedure that again is possible here. Data augmentation. So this is a very, very big again very important revolution that has happened in Gen AI. So what is data augmentation is, it's usually we augment data, right? Whenever you don't have enough data, so you have to augment the data so that you will have a big data set in front of us, right? So data augmentation in healthcare is, see, there are some diseases which is very rare, right? The data which is available is rare, one. Two, the data that is available has a lot of constraints, like the privacy constraint of the patient, whether they are willing to share the data or not. So these things again restrict the amount of data that we have in hand, right? So that's why we have to augment. Say, for example, 50% of the data is the actual data, then there can be another 50% of the data which can be augmented or synthetically generated, right, for training and research purpose, so that we'll be able to train our models better. So we are going to see algorithms which does that, right? How it's able to create whatever you give them a sample image and you tell them this is what I am looking for, it is able to augment. So that is again a very important step here in generative AI, right? So moving on. Okay, so we will start with the first, first, what do you say, a breakthrough, or the first application of Gen AI in healthcare. The most important application here is a synthetic patient data generation. So we are going to see some videos also to understand how important is this synthetic data generation. So already we have discussed about a lot of things. The data privacy we discussed about the scarcity. Not every disease has a lot of data which can be used for analysis. No, we have scarcity of data. We have discussed about that. We have discussed about confidentiality and all those things, right? So we already know these are the barriers. So what is the solution for these barriers? So what can I do? So we can do something called as synthetic patient data generation, right? So I have just taken into account two algorithms, because that is what we will be discussing a little more about them. So first is GAN, right? The other one is VAE. These are the two algorithms. So using these algorithms, there is a reconstruction that has happened, an MRI reconstruction. You can see an MRI reconstruction is the first image. If you see that there is an image, sample image given, and there is an image that is reconstructed, so that it's again no data augmentation, you can say, right? So there is another image where you can say that low dose CT denoising, right? So you have a CT image already, you are only concentrating on a particular, so high resolution can be done of the existing CT. So your image is able to, your Gen AI system is able to read that image and enhance the image. So again, so that you will see things clearly, you can zoom into one particular area. So if it is not no having a proper resolution, this also can be generated. So it can generate images which is of low resolution and give you a high resolution image. There is another one very important breakthrough. This is nobody would have even imagined, or a common common people like us who doesn't have much medical knowledge, it is very difficult for us to even imagine such things. Synthesize the MRI. So I have done an MRI. So many times this happened during COVID time. They will ask you to get a MRI of your lung, okay, and then they will see this is not clear, or they may say that we are uh, detecting, or we are able to see that there is something more that is missing, and so they ask us to do a CT also. Again the two types of radiation. Imagine patients having cancer already, no, they have a lot of chemotherapy and a lot of radiations are going on, and you cannot keep the patients radiated. So what is this is, here I have an MRI scan and now that is converted into a CT scan. Again, it is a very big breakthrough for synthetic data analysis. Right. So this is the example I was talking about. Eye vessel to eye fundus image. So with the eye vessel image I have, that image I am converting it into a fundus image. Right. This fundus image is a complete image of the eye. Right. So there also are sometimes, though these images are not properly generated, I will also show you some anomalies where this fundus image is going to be, it's like a mirror image. Okay, so where there are two different circles that you see inside the image, right? That anomalies also are detected. We also, research is going on, and how do I first generate it and how do I fix those anomalies, right? And we are heading there. We are heading there. We may not be there, but we will very soon be there, right? So again, reconstruction using another algorithm, VAE. Right? So original image is there, whatever original image is there, we are trying to reconstruct another image. Say for example, the one which I could understand is the chest X-ray. Right? So I am able to generate exactly a similar X-ray there. So these are again reconstructed images which can be used for further study. Right? So whenever there is, sometimes there is, we know that normalized data is required. Let's say for example, classification. Right? So what if the data is going to say that lung infection is less and without lung infection patient data is more, right? Then we have to normalize. In that case, again, we can go for reconstruction of images. So this is again one big breakthrough that we are looking forward. So researchers can now access vast amount of information, which is realistic data. So it is not the real data, but it is realistic data because it is a synthetically generated data using GenAI. Right? So that would further improve testing, right, and validating the treatment. So is this treatment is going to suit them or not? Now we have more data in hand. Now we can say decisively, we can say with full confidence that yes, this procedure is going to work for that particular patient. Right? So that is how synthetic data is important. Right? So now I would like to show you a video. So I would share it from another screen because I'm not able to play from here. Yes, I will again share another screen wherein I'm going to present you with that particular video. So these, in order to decrease the monotony, like keep speaking. So in order to avoid that, so I would like to do that. Yeah. So we will see the video. And there is also, again, a lot of learning from the video itself, I would say. Right? And if there is any problem in the audio, please let me know.
Generative AI is transforming healthcare with synthetic data, unlocking high-quality, unbiased data for medical device companies, pharmaceutical companies, and academic medical centers, leading to faster discoveries and improved patient outcomes. Generative models can help identify complex disease mechanisms, predict clinical outcomes, and prescribe tailored treatments for patients. MONAI, a framework for building and deploying medical AI, is also advancing generative AI with methods to create large synthetic data sets for training generalizable AI models that can learn from evolving patient data while preserving patient privacy. The latent diffusion model is a breakthrough in generative AI for medical imaging and is being developed by King's College London, co-founders of MONAI. This model can generate synthetic medical images of the human anatomy, including high-resolution brain images. It was trained on the UK Biobank dataset and NVIDIA DGX Cloud in just 1 week, enabling researchers to control global and regional brain volumes and adjust for age, gender, and disease. Generative AI is already making an impact in clinical settings. King's College London and University College London have developed a novel transformer-based outlier detector that aids in clinical evaluation of deployed segmentation models. The results suggest that this approach can be used to ensure only expected and good quality data reaches downstream decision-making algorithms. NVIDIA, Mount Sinai, and East River Imaging have collaborated to develop a new generative AI model for medical imaging known as RAD ImageGAN. By utilizing the StyleGAN XL model and training it on the RAD ImageNet dataset, RAD ImageGAN has become the most diverse synthetic data generator for 2D medical imaging. The model is pre-trained, robust, and adaptable to create other 2D medical imaging models, providing greater flexibility for medical researchers and professionals. Overall, generative AI models such as RAD ImageGAN and latent diffusion models are driving a revolution in healthcare. They provide high-quality data that can be used to train deep learning models, leading to improved patient outcomes and enhanced performance of medical imaging models. To access these models, visit the NVIDIA NGC catalog or Monai Model Zoo. Ready to join the future of healthcare powered by generative AI?
Yes. So this is exactly what we were discussing, the synthetic data generation. So using RAD, okay, RAD, GAN, and all these algorithms. Right. So moving on to the presentation. Okay, so now was the next topic in GenAI. First, we saw the synthetic data generation or data augmentation using GenAI. The next very very powerful or very useful revolutionizing technique, or you can call it as a breakthrough, like I have mentioned in the slide. It's going to be drug discovery. Right. So here drug discovery of again the permutation and combination of the patient, right, according to the patient history, according to his genetic structure, right. So what kind of medicines are you going to give? Even in pharma there is revolution wherein there is this compound design. You're going to design the molecular structure of these drugs, right, and you're trying to find a match, right, of this patient and drug match, so which will work efficiently. Again, it is a very big breakthrough. So I've listed some of the companies who are already working on this, right, where drug discovery is concerned. So what is all the things which is going on in drug discovery? Target identification and validation. So we have to target the, so let us say, patient, and also target the sequence of drug we are going to prescribe, right. Drug screening, right? The molecule level screening can also be can also happen for prescribing these drugs. So drug screening. So first we are trying to personalize the drug for a particular patient, right. So we go in for drug screening. Drug design, again drug design, there is so much of visual images available on to directly see what is the effect of the drug on the sample, okay, the sample of the patient's say the pathology, right. So what, how do they design the drug? So all this can happen even without a clinical intervention of the patient, right? You can do it outside, right. So you have both the data with you. You are trying to design the drug which will particularly suit for the patient with permutation and combinations. Again, GenAI is going to play a vital role in that, right. So similarly there is so many physiochemical property prediction, drug target interaction, drug toxicity, so for which people this drug is going to work fine, or which patient is going to have an allergy, right. Even before giving it, administrating the drug to the patient, you will be able to see, right, the toxicity level for that particular patient. So these are all huge breakthroughs which is going to cut short on time, right. It is saving a lot of time, where you will be able to directly prescribe a drug which is going to work for that patient, right. So accelerating medical breakthrough through drug discovery, right. The first step is going to be the target identification. As I told you, it could be the human identification of the target, which where you're going to apply this medicine. It could be a drug, screening, as I said, the molecular structure of the drug again can be identified, the suitable drug can be identified. Then comes the generating molecular structures, right. Can I change the molecular structure which will give me the efficacy? So which structure is going to suit for this kind of a blood sample? So again, you're going to do such kind of compound design. right? Again, the last step is nothing but prediction and testing, which is going to work for us. Right? So drug discovery is going to be a huge, huge breakthrough when these no very what do you say, the diseases which is going to be no which could cause a life, human life. So there it is a very, very big, huge breakthrough, right? Okay. So what is the pipeline? How does it look like? We actually have the data collected. So data collection, as I told you, it is not just going to be your sample of blood. It could be from various sources. It could be a lot of clinical data where we are going to involve these scan images, the pathology images, the way it, your genetic makeup, right? The genetic makeup is there. So those, all the data is going to be collected from all these various sources, and then we analyze and find out if there is a pattern which exists. Okay, if there is a pattern, there is a patient who was being treated with so and so medicine which who has the same pattern as that of the current patient, then can we try that? So that kind of analysis can be done, right? Then we are going to say this candidate generation is again all about pharma, where we are going to talk about the molecule level structure of your medicines and whether will they work, that kind of molecule will work for this particular disease, or can I redesign the whole molecular structure itself? So these kind of things can be discussed, right? So of course, validation and testing, we have to apply it in the lab, test it with samples, and then go for clinical trials, which is a very, very huge procedure. So again, you have to be responsible in handling the clinical trials, so where it is tested on humans, right? So what is that transformation that we have had is, traditional drug discovery takes about 10 to 15 years, right? So even during COVID time, that is what they say, right? So every penicillin, every vaccination, it has taken more than 10 years, and they said it is very difficult to come up with a vaccination. Then imagine the state of art, no, facilities we have today, the AI algorithms we have today. So, and the cost also can be reduced because you are reducing the time. So AI reduces this time by 50 to 60%, which means half a time, less than half a time, it is able to uh, figure out what kind of drugs will work for what kind of diseases, right? So this will significantly lower the cost and also the failure rates also, you can see. So we say that efficacy of the testing is going to increase, like lower the failures, and it is going to increase the efficiency of that particular drug. Okay, so again, this is a huge breakthrough, right? So we again have a video to watch. So let me go again share this particular screen with you.
Of new drug therapies. The drug discovery process can be broken down into 3 phases: identifying the target disease, generating leads for potential treatment, and optimizing those leads. Generative AI is adding value to each of these stages, transforming how we approach the monumental task of developing new drugs. For instance, NVIDIA collaborated with Recursion Pharmaceuticals to screen quadrillions of molecule target pairs, a task that would have taken millennia with traditional methods, and completed it within a week. A really inspiring use case comes from In Silico Medicine, which partnered with NVIDIA and used generative AI to develop a treatment for IPF, a type of chronic lung disease, in a fraction of the usual time and costs. This breakthrough demonstrates the potential of AI to bring new treatment to clinical trials much faster.
Yes, that's true, right? So going back to our presentation. So this is all about drug discovery. We have discussed, right? The next very, very important area in Gen AI healthcare is personalized health content, right? So the way the image looks itself gives us a lot of insights and a lot of hope for our future, right? So imagine we go and spend hours together for doing a full health checkup. You have to walk into different floors, different rooms for every test. Imagine there is a healthcare pod like this, and where everything can be done in a very less time and in a single place, right? So it gives us a lot of hope, though it is AI generated image only, but still we are very very hopeful about personalized healthcare, right? So this is what is expectation that we have, right? So what is that we are going to give? How do we tailor make the personal or tailor make or personalize the health no healthcare for every patient by patient? First of all, as I told you, it is you need your medical history, which is available today. All of us have a huge history. We leave a big footprint behind us. Every medical test we did, every no every scan we have done, every blood test we did. So everything is available. Every data is available. So there is also data about, say, the other generations. Maybe at least one generation. We have the privilege of at least having and storing the data of the one generation which is ahead of us, right? The lifestyle, right? The preference of the patient. So again, choices that he wants, whether he wants such a treatment, is he able to undergo such a treatment? Does he financially be able to support such treatments, right? So does his age support such a invasive procedure? Right, so these things are there. Those are the preferences of the patient. So you can tailor make a plan for every patient, right? So whenever you talk about tailor made, this is the information that was very very exciting, that if these information about you is available, then there is a system that could predict and say in the next 20 years what will be the medical problems that you will uh, get, right? So that is a big huge breakthrough, right? Again, it has to be, is it trustworthy? How is it going to be handled responsibly? Or what if that information whatever they give us is no, it's not right? Okay, it's a misinformation. So again, these are the things which we need to work, right? But let us be positive. So the personalized approach is going to improve the test efficacy, and the overall health outcome of a patient is definitely going to increase and it's going to become better. So that is again one area which we have spoken about, right? So intelligent health decision support. So this is what I said. So there are healthcare providers who will take a decision. Right now, we have also seen in hospitals where the young doctors, okay, always take an opinion from the elders. They discuss with them and come back to us, right? So now the discussion is going to not happen with another doctor. It could happen with a Gen AI app, right? It could happen with the Gen AI app, which is going to just support their vision. So whatever the informed decision they have taken, they are going to get another person who is going to support that particular decision. So what is that we are going to do? We are going to take all the data of a particular person, and we are going to find out patterns, right, which is not visible to human observation. These patterns can be taken out by these Gen AI technology. The technology will do that part for you. And the healthcare providers, of course, it's not like we are going to only depend on the technology. The healthcare care providers are going to take that as a helping hand. It's like a support. So the decision that they make is going to be more confidently made by them, because that decision is also being going to be supported by these AI systems, right? So what is very important in personalized treatment? You have to identify patterns, right? So you have complex data, so you have to identify patterns of this data. You should be able to identify similar patients, similar treatment that's been available, or you have to identify similar drugs which can be given. So pattern recognition is going to be one very big technology that we have to depend on for this personalized treatments, right? Of course, the predictive analysis is AI itself, right? So AI in healthcare, you have forecasting treatments, the potential complication discussion, the prescription of the treatment. So all that again comes under predictive analysis. So it is going to go hand in hand. The predictive analysis is going to go hand in hand with the whether it is drug discovery, or it's going to be synthetic data, or other breakthroughs that we are going to see these breakthroughs. So tailored interventions. So the medical practitioner has to do a tailored intervention, tailored for every patient. So case by case, we are going to handle it. That actually is going to give you a lot of insights, right? It's not like before. No, you just say somebody has got a fever. Right now, everybody asks a million questions. What did you eat? What did you drink? Was there in your school? Was somebody sick in your school? right? So we already have become experts, and we are already trying to personalize. Imagine there is a system which takes the real data, so your pathological data, your scans, and then it is able to give you a decision. That is going to be excellent, right? So that is what we are going to get now, the personalized recommendations for every patient. So you have to first, so the challenges are also there, that you have to integrate the data. So I would say that data is going to come from everywhere. It could be a blood test, it could be a scan, it could be a wearable device, right? We had a session on that. So it also could be a wearable device from where you get the data, and are you able to integrate the data, and how are you going to come up with patterns? So that is going to be a huge challenge. We have to come, so there are so many companies working on that. So NVIDIA, I hear a lot of breakthroughs happening, especially in the healthcare domain. So you have this, to explore more. So people who are into research, please make sure that you do a lot of research, and there is so much scope to do research in Gen AI. So very, very good topic chosen by our team, right? So recommendation generation, it's not just recommendation that, no, so this is because of this you have that. No, it is recommendation system which is going to always be backed up with, say, things like no, explainable AI. So why did you take such a decision? So why do you say that this particular patient has a so and so disease? So you have, data which is going to be supportive data is there, so huge support is there. So you have to create evidence based personalized treatment, right? So that is again one very important thing which we have to remember. So it's not a challenge, it is something that we have to consider, right? So, and we have to scaling the approach, right? It should be scalable, it should be available globally, right? There is no point in the one country having all the, advancement and the other countries suffering. No, it has to, everything has to be scalable, right? So we have to come up with, our research has to come up with systems which is going to be cost effective, right? It is going to reach to so many people, it is going to cater to different what do you say, race. No, it is not, your discovery shouldn't be only no, supporting one particular race. So we should have that widespread adoption of this particular technology, whatever we are going to talk about. So we have to keep all those things in mind before going into the discovery mode of those treatments, right? Yes. So this personalized recommendations, let us again talk about the genomic analysis. So again, that is a very, very big area, which again, we should know some information about it. So what is it about genomic is what we are going to now see in this next video. So whenever we speak about, personalized healthcare, we have to, we cannot skip without talking about the genetic makeup, our genetic makeup, and what diseases are we prone to. So that is a very, very important discussion that we should have. So let us watch this video.
Analysis, powered by GenAI, opens the door to highly personalized medicine. By analyzing genetic markers alongside medical history, GenAI models offer treatment recommendations that align with each patient's unique biology. In mental health, for instance, GenAI tools help customize CBT strategies based on individual needs, while in oncology, they identify targeted therapies that improve patient outcomes and minimize side effects. This level of personalization allows treatments to be as unique as the patients themselves, supporting better long-term health outcomes.
So right. So this is also going to be a very important, study and the important breakthrough for us to be able to personalize the healthcare for every individual, right? So moving back to our slides. Okay, so what is next? Disease prediction and prevention. It goes on, there are so many applications of Gen AI, but we are only covering a very few ones which really will be, there will be a breakthrough in these areas. So that's the kind of applications I have taken. And one such application is again disease prediction and prevention. So we have already seen how disease prediction is going to be done, and it is going to be done in a personalized way also, right? So taking into account a lot of considerations. The same discussion is going to continue. So we are going to identify a potential health risk, right? So health risk, say for example, of a particular patient, right? What is the risk that we have? Or are we able to predict the future? Right? Can we do something preventional? So that is very important. So all these researchers has something in common, that is not diagnosing what is today. That is also important. Just finding out the drug which can be supported for that particular patient is important. Yes, but more than anything, what is that? Normal people, healthy people, what are they looking for? They are all looking for the potential health risk identification and prevention. Will you be able to tell us now? So it's like a astrology, right? So somebody can just show them the reports, and they will be able to tell you, yeah, in another 5 years you may get this, right? So you have to take care of your heart. You may have to take care of your liver. So they may tell you take care of your kidney. So this is are the potential risk that you have, right? We would love to hear that and prevent those diseases, right? So that is again very important, because this is the part of prediction and prevention which many 80% of the general population would need, right? So the sick people are the other 20% of the population. Of course, they are the priority, but still this also is going to help us, right? So for which we are going to use the data from all the electronic record data, the wearable devices data, all these data, the ECGs, the MRIs, the CTs, all these things we are going to use, and we are trying to predict, right? So does any patient's record is similar to the record that we have, right? A patient today may not be a patient before say 5 years. Is his health data similar to the data which I have today? Then there is a potential risk, right? So that kind of an identification is very important. That is only possible in deep learning models, because the deep learning models are the ones which can deal with a lot of data, huge data set it could deal with, compare these data and then come up with patterns, right, which is similar. Okay, so how does it work? Of course, there is a lot of sources. You have to integrate all the data, and then you have to recognize the pattern. And then once you recognize a pattern, you can say early intervention. Okay, prevention is better than cure, right? We have to take measures to prevent those diseases. So by catching the disease early, AI powered prediction systems can reduce the treatment cost by 70%. So that's the most scary thing today, right? Getting admitted in a hospital, falling sick, and paying not able to pay for the treatment is going to be the biggest the threat that we have, right? So if that can be reduced 70%, then what more can we ask, right? Which will drastically improve the survival rates, right? So reducing the cost is again a big breakthrough that we are going to get. So of course it's not going to be easy. We are going to have a lot of challenges. So again, acting responsible. So you have to protect the individual privacy. Only if the patient is ready to share his data, it has to be shared. Even if it is shared, it has to be encrypted before use in any AI model. And then there is always this algorithmic bias. So make sure that what you feed is what you get, right? So what you feed into these systems has to be unbiased. Only then the output also predictions will be unbiased. The trust people are going to have. The beginning, if you remember, when we use ChatGPT, it is going to be, it was not as accurate as it is today, right? And we are evolved so fast. Not even 6 months, no, it is taken for it to actually be more sensible, right? So that kind of thing will also happen in Gen AI for healthcare. We should wait patiently, have trust, right? And once and everything comes accurate is when the policies are going to also support, right? So that's the thing, trust, building trust. So we are as researchers, we have to work towards building trust. When will the people get trust on these kind of AI generated healthcare healthcare providers? Only when it is accurate, right? So we are also have the responsibility of making things more transparent, more accurate, and interpretable. So interpretable here, that's where your XAI, you had a session yesterday, that's where you're going to interpret, right? Why did this output come like this? It came like this because of so and so reasons. So it also has to be interpretable, right? So all these are important for drug prediction. So we have almost done with all a lot of say applications which we have spoken about Gen AI, right? So we are moving on maybe with this framework discussion, we will move on to how it can be done, what algorithms can be used, and how those algorithms are going to work. We'll have a small discussion on that. Okay, so yeah, the framework of disease prevention is this: continuous monitoring has to happen, continuous tracking has to happen, risk assessment has to be done, early warning and prevention. Right, so this is of course a cycle. So where continuous monitoring, you know, save every record of yours, medical record of yours. It should be in a digital format. It should be tracking. You should have these wearable devices, which is also tracking your every move. Right, and then there is of course risk, like potential risk is there, where the identification of pattern also can bring in some threats. Okay, we may be, no, may not be true, so there could be some prediction that this is the disease you are going to get in another 5 years, and we should take it with a pinch of salt, because no, that may not be true. We have to wait and see. So this is not God, right? It's just trying to warn us. So this has to again be, there is a lot of risk involved. So, and prevention. So we all this is done not to know the future. It is not to get to know the future. It is so that you take some preventive action, so that doesn't, whatever was predicted doesn't happen in the future. So that is why all these things are done. So this is going to be a cyclic approach. Continuous improvement has to be done, enhancement has to be done, wherein you predict something and the patient is benefited by taking preventive actions before the event actually occurs. Right. So with this, we are coming to an end of this discussion. Right. That's what I thought so. But there is another topic that I think I have added. Yeah. So we'll also talk about imaging, because I want to talk about imaging and then go to those examples, because all those examples are going to be based on medical images only. Right. So what are medical images we are talking about? We have PET scans, X-rays, CT scans, MRI scans, and ultrasound. Right. These are some of the imaging techniques. So can I generate one from the other? Again, this one discussion. Can I enhance the existing, uh, say, an image that I have, right? Image generation. Can I enhance it? So these are all the improvements that we are speaking about for Gen AI. So X-rays is going to, again, you know that it is going to be bone and tissue visualization, CT scans, cross-sectional image, MRI scans is going to be high resolution, soft tissues is going to be visible, more visible. Ultrasound is going to be organ and blood flow assessment. Okay, so some could be a kind of a pictorial, an image. It could be a video, right? So we have all the different types of imaging that is done in medical, right? First of all, we should know how each imaging is done and what is the difference from one to the other. So when we are generating, we should completely understand the domain, and then we will be generating. So these technology will provide insights. So I have an X-ray, a CT scan, ultrasound, and an MRI. Then I will be able to come with valuable insights. So I'm going to study the patterns in all these imaging and then come up with a valuable insight. Then proper medical interventions can be given. Right. So that I wanted to just give you a glimpse of what are the different kind of imaging present, so that when we are going into the implementation of the deep generative models, right? So I will just touch upon on what models are there and how they basically work. Right. Not going to be in depth. Of course, how are we building these models with whatever knowledge we already have? So we must be having some knowledge on AI and ML, some knowledge on deep learning algorithms like your CNN, RNN, whatever, and using that, how can I implement these generative models is what we are going to see, right? So before that, I would like to tell you that the medical images, right? When you are going to do generative modeling of these medical images, you need you need powerful systems, GPUs, right? So since no, I am not equipped with such systems, what I have taken is I have taken into account a normal data set, right, a normal image, and then I have done this, ran this algorithm, so that just to avoid the crashing of the CPU, not, since it is not a GPU. But I will also tell you the same thing, how can you adapt it, or how does that output look in a medical image. So that also we are going to see one example I will show you quickly. We will quickly go through. So what algorithm we are going to discuss? We are going to discuss like 3 algorithms I have picked up. So which is going to be the core of all these algorithms are going to be deep learning or neural networks. That is the foundation. The first algorithm we are going to talk about is called as variational autoencoders, VAEs. The other one is called generative adversarial network, which is very popular in generating images. It can generate real high quality images, and we also have auto-regressive models, which can generate sequential data, right, using a predictive modeling or using a probability theory, right? So we will see what these models are and how can they be used, right? So one by one we will see. I'm starting with yeah, GANs, right? So So what is the first type of system that technology that we are talking about? We are talking about GANs. It is generative adversarial network. So it is easy for you to remember how GAN works because, of course, it is a generative model. It should be using some deep learning techniques inside it. It is adversarial network. So what do you mean by adversarial network is this GANs are going to have two parts in the algorithm where one part is called as a generator, the other part is called as a discriminator. So what do you mean by a generator and a discriminator? So there's going to be these two people. It's like you have in your office, you have competition. Let us say that you are there, say A, and there is another person B who are competing. So you're going to compete with each other. So what is the work of the boss is that he's going to say that person is better than you, this person is better than him, so that there is a competition created between you, and both of you are going to excel. Right? So that is the same strategy that we are going to follow in GANs. Right? So what is GAN doing is, so we are giving a source image, let us say an MRI scan to your algorithm. Right? What it's supposed to do is it is supposed to generate a similar algorithm, a realistic looking similar algorithm. I'm sorry, realistic looking similar image has to be generated. So this generated image is a synthetic image, right? So you have an original source, you are trying to generate a synthetic image, right? With that, you could have say an end of the story, but it doesn't end that way. So what the other part of the algorithm does is it is trying to find out whether the second one, which is generated, is it generated or not. It is a real data or a generated data. It is going to keep finding out whether it is real, fake, real, fake. So when it says real, then generator wins. When it says fake, generator loses. So generator always have to work against this discriminator, which is going to find out whether that is real or fake. This is going to be a game. It is going to be in loop. So the more and more discriminator finds that it is fake, the more and more realistic images your generator is going to generate. So isn't that interesting? This is how GANs work. GANs have a proven record of it's working for normal images. So same thing is true even for healthcare, right? Generating images in healthcare, of course. So image generation is image generation. Your system doesn't know whether it is a healthcare image that it is generating or is a picture of a dog or a cat. No, there is no difference. Image generation is image generation. Right? So that is why this competition is what is going to create realistic images using GANs. Right? The next algorithm that we are going to discuss is called as variational auto encoders. They are called VANs. Okay, variational auto encoders, VAEs actually, not VANs. So I put GANs and then I've typed as VANs. It's a typo. It is VAEs, right? Variational auto encoder. So what is the theory that it is going to work on is, it is going to work on a probability theory, right? It is going to work on the probability theory. So it is going to have controlled versions. So based on the probability of the sample. So this could happen or cannot happen. So that is going to be the probability theory. We will also see one example of that. So there is also another AI model which I have picked up. It's called auto-regressive model. Right? So again, it is going to be a sequence to sequence, like your LSTM model. It is going to be sequence to sequence model. It is going to generate step by step and then check with the source. Again, generate it, go a little bit further and check with the source. So sequentially, it is going to generate like your LSTM algorithm or your LLMs in text data analysis. Similar to that, this auto regressive model, right, is going to work. So each architecture has its unique strength. Right? For example, VA is, though it is working on probability, what is the concept it is going to work on is, there is this challenge, as I told you, even I am not able to execute, I told you, because of the power of the system not being that which can be used for generating these MRI kind of images. Right? So what is the complexity or challenge that we have here is the size of the data. Right? So what does this VAE do is, first of all, it takes the data and it is going to present the data or convert the data, or in other words, we are going to call it as encode the data into lower dimensional space. So that is called as latent space. Right? Latent space, as you know, it is an ML term where we are going to present the data into a lower dimensional image. So it's going to take it from there. So convert all the images into a lower dimensional image where processing is going to be easy, and then you're going to generate using that lower dimensional image as your input. You're going to come up and generate your synthetic data. So that is going to be VAEs. So another technique is going to be GAN. Right? GAN, as I told you, you know why that competition is going to, so it may look like why there is a competition being created, but competition always is created so that, you have two children, we always create that competition so that both excel. right? So that is what is the secret of GAN, which gives you realistic outputs. There is also auto-regressive models. Again, this is a sequence-to-sequence model, transformers, right? One example is transformer models. So you can now, by now itself, you can guess what can be used for what type of algorithm. So which library is going to be used, or which technique is going to be used, right? So that you can guess already from the way they work. But still we will get into each one and see how they are going to work. So we will go quickly. GAN. So building a generative adversarial network. So now you will never forget the name. You are doing a generative adversarial network where it's going to have a generator and a discriminator, right? So let us see, try to understand it just using the picture. So I have my training data set. I have an image. So my generator is supposed to generate an image which is going to look very similar to what was there, right? It is going to, of course, take a lot of epochs, a lot of, what do you say, faces. You have to generate it face by face. And whenever there is an image generated, immediately there is a discriminator which is judging the image and saying, no, no, this image doesn't look like the source. This looks like a AI generated fake image. Right? So that is the work of the discriminator. So people, if you have people who always keep judging you, so you should always remember that they are only improving. Right? So this discriminator is a one algorithm which is going to improve, okay, the generator algorithm. So it's going to just say it is real or fake. So competitive learning for realistic generation is what is happening. Okay, so what is after this, after the whole process, what happens is what you get here is a generator, generated synthetic uh, images. That's what you get, right? So that is why, to make it realistic, we also have a noise component which is added. You can see that. So we also, when we are designing our program, we also have should have this. So what is that we have to check? We have to check how accurate it is. We have to check what is the loss, okay, in the data between the source and whatever you have generated. So this is how your model is going to be generated. So you have generator, you have discriminator, and this training competitive interplay between these two is going to give you a very realistic output, right? As the discriminator improves, the generator must become more sophisticated to fool it, right? So by creating, this is a virtuous cycle that is created so that you get a realistic output. So this is very effective and very, very popular, right? Okay. So what is that we are going to do is some basics I will tell you. So we are going to configure. So you have to first say whether you are going to use a CPU, GPU device. You know, right? People who are already into ML programming. So you have to also set some hyperparameters has to be set. The data has to be given. You have to shape the data as however you wanted to pass it. So that is model initialization. That is the first step. I'll also take you to the program. After model initialization, we are going to calculate the loss so that we know we have to keep decrementing the loss. So what is the loss function I have used? This is one of the, say whenever I talk about GAN is not a library that you can call, right? So it has some steps and we are going to program it, right, manually. Every step is going to be programmed. So you have to choose a loss function, you have to choose an optimizer, you have to choose which kind of convo network you're going to use, what is the structure, how many layers you're going to have, right, what kind of activation function you're going to use. All that is again in our hands, which is going to make it more challenging. So the output all depends upon all these setups that we are going to have. Only then what we get is going to be generated. Right? So more technically, I'm not getting into all these techniques, but I'm just telling you these things has to be done for you to build a model. Right? So there is a module which is going to be a generator training module. There is a module which is going to do something called a discriminator training, and then there is a loss function which is going to keep calculating how it goes, and then you're going to generate the realistic model. Right? So we will see that program. We'll go to the program. So before that, this is what I have used. I have actually in my program not able to use this data which was huge. Data sets were huge, which I was not able to process. Even these data sets, it was difficult. It took hours together to generate images. Right. This is a data set called CIFAR data set. It has it's actually created for identifying objects. Say it could be animals, a car, all these things. You would have come across with this. Some of you would have worked with this data set also. So I've taken that specific data set. I am going to try to recreate that, and this is the image I got. So why I have got such a image with so many grains? Because that's the number of iterations I have gone for. I have gone for limited number of iterations, again, due to the lag in the time the time was not much time was given to the system, and two, we have not provided it with a proper device like a GPU, right? So otherwise, actually what has happened is there are different kinds of GAN. GAN only is, I told you, GAN is not going to be a library function which you're going to call. It's going to be created. So there are different types of GANs that you can create, and which each GAN. So I have given a source. I want similar one. I have given a reference, and these are the images that were created by so many different types of my GAN algorithms. Right. So this is again one example of how it actually would have created. But what program I will show you is going to be of this CIFAR data set. Right. So we will just take a small thing. We will go to the program just to show you that how easy it is, right, for you to try on this topic. So I will stop this presentation and go take you to another screen. Um, the fact is that even to write this program, I had to use an AI, generative AI tool, code generated. So one of my programs which I had for GAN was not working. So I had to take the help of the cursor AI. That is why the name is GAN cursor. Other things I was able to get it in the first go. Right. Again, some things I wanted to tell you, or whatever I know, I will be telling you that already we told you that you are going to first have this thing. First, you're going to have the setup, then you're going to have an algorithm for generator, then the algorithm for discriminator. You can see in both the algorithms we are using conv only, CNN only we are going to use. Only thing, the activation function you have to pick. I have picked ReLU for generator and leaky ReLU for discriminator. So and then the TANH activation function for the last layer after densing, flatten layer and all that. This is the last thing I'm going to do. So these are the algorithms. So again, I'm telling you, it is not going to be one function that you can call. So it has to be designed manually by us. Okay, GAN. Okay, so again, what is the loss function I'm using? What is the optimizer I'm using? I'm using the Adam optimizer, and BCE loss function is the function which I already told you is what I'm using. Right. So how many epochs? I have only stuck to 100 batches, 100 per batch, and I have only kept 10 epochs. So that itself has taken say 2 to 3 hours for training. And this is the image that is generated. I will be able to share this. So now when you have systems that will support, so same program, it's the same technique, but we are going to use it for a healthcare database. Right. So that's all is going to be the difference. So this is one program that we are going to, this program also can be circulated to you. If you are interested, you can write us. We will be able to give you these programs. So it's available, right? It's available in a lot of websites. You have Analytical Vidya, Geek for Geeks, right? One of those websites only even I would have taken, right? This is one thing. Another thing I want to tell you in this program is that the same program can be written using different libraries. Okay, say you can either use PyTorch, which is the latest one. Okay, where I have used PyTorch. You can also use Keras, Keras TensorFlow also. Whichever you are comfortable, you can write the code in any of the using any of the libraries, right? So say once I am here, I would also show you what other programs are, so that I can only not come back to the screen, right? So again, I'm writing an encoder here, you can see. So we are going to write an encoder program, then I'm going to write a decoder program here, right? And I'm going to use the CNN only again here. ReLU I'm using for both encoder and decoder. So we are going to reduce the dimension and then try to learn from the lower dimensional data and then produce or generate the higher dimensional data. So this is what I have done. I have used a data set called MINST. I think most of you would have worked with MINST. It's also a popular data set. So this MINST data set, this is a fashion MINST. So where you give an image of a garment and it is going to generate it. So you can see the beginning. You can see the image and then you can see the generation. So it is going to start from minus 0.5 and it goes on. Right? So that's the value of Z. Actually, Z is going to be a combination of variance and say mu and sigma, mean and variance. So we will also discuss that in one of the slides, right? So again, this is not a function which you can just call. So you have to follow the steps of the algorithm, the pipeline, and then write your code. Okay, this is also similar autoencoders. It's also a similar kind of algorithm which is similar to VAEs. So those encoders are variational encoders. These are autoencoders. Slight difference is there between both of them. right? So here I have used again the minced data set, which is used for digits, right? So we have given the original digit is given and what is generated, right? Reconstructed and generated looks very similar to this, right? So again, if you can run for many iterations, you will get a perfect similar output, right? This again with auto encoders, right? So concept is going to be very similar. So only thing is we are going to use different pipelines, different steps for every algorithm. Okay, so we will go back to our slide. Right. So however, we have discussed GANs. So now we will quickly discuss about the other, what do you say, techniques also, right? The other technologies, autoencoders, for example, right? So here, what is the thing I was telling you is you have an encoder which is going to take the input and suppress the input into a lower dimensional image, right? So that is nothing but your latent space, compressed. It's like you have dimensionality reduction, right? This is like compressed features. Features are compressed so that it is going to be easy for training, right? So using these compressed feature, you are going to do the training and the decoder is going to reconstruct that image. And you are of course measuring the loss function in that, right? This is auto encoder. So you have the input image, you have a decoder program, you have an encoder program, and what you have in the output. So what is the step, what is the pipeline of this encoder program? It should of course have an input layer, a flattened layer, a convo, right? A flattened layer and a dense layer. So all activation functions which I have used. What is the dimensions shape of my data is what is written here. But you can, it differs according to the data set that you are going to take. So otherwise the steps are going to be same, right? Yes. So again the steps are going to be initialize the model and then you have compiling the model. Of course you have to set some hyperparameters here, right? And then we are going to move into the model. So this is how the reconstructed model looks like. We saw that in the program. I would like to show you an actual counterpart of that which is done in healthcare. Sorry that I couldn't actually take this data set and program it for you. But we have other researchers from which Springer Nature, I think so this image is from one of the papers. Right here, what has happened? There is an original image and there is a reconstructed image, right? And this very interesting image, this I got because, see, there is a reconstruction error. So as there is no research which is happening in trying to make it as original as possible, there should also be parallelly research going on finding the abnormalities, anomalies, right, of or error in that reconstruction. So for us, it may look like very similar, but again, you should have a program which is going to see the error, that is the difference between the original and the reconstructed image. Again, that is one big research that you can think about. Right? So if there is one group of researchers, you are going to research and reconstruction, synthesize data, the other group of people can find what is the problem, and that's when it's like the generated discriminator only. That's when the research is going to grow. Right? So what is the key takeaway from this particular algorithm? It is very efficient in compression. So compressed data, so the performance is going to be strong. So strong performance is there. So you can either use TensorFlow and Keras or you can use a PyTorch. Again, it is up to you what you're going to use. Right? So again, VAEs. So similar to autoencoders, you have VAEs. Right? This VAE is going to work same steps, encoder, latent space, decoder, but it is also going to work with this probability distribution. So there is a, say, image, you have image of a chair, then you have a encoder that encodes the image and gives you a image in a latent space, in a lower dimensional space, and then you are going to decode that particular image and generate an image which is similar to whatever you had. Right? So this can be used, key applications are high quality image generation can be done, text synthesis and manipulation, data augmentation, anomaly reduction. For all of these, you can use VAEs. Right? So this is how VAEs are going to work. Okay, so the pipeline, I already told you this pipeline, this is how it is. This is like kind of your residual error which you will calculate, right? So similar to that, we have something called as a reconstruction loss, and there is also a KL divergence loss. Right, so we are going to have take both the components together and calculate the total loss. So I will show you somewhere I have that. Yeah. Yeah, the total loss we are calculating is keeping into account both the reconstruction loss also. It is not just the loss of the learning model, it is also the loss in the reconstructed image, right? So again, the architecture is going to have an input layer, a convo layer, a dense layer, and then a latent space, right? So the sample, that latent space sample you have is going to be of lower dimension. So this is how the latent vector is going to be represented using mean and variance, right? Of course, taking into account the error component. Okay, so this is for my model, whatever I have used in the program. So I am just doing this is similarly you can construct, reconstruct, or write a similar code for your data set, right? So these things has to be given. This is for encoder. Similarly, for decoder architecture also, this information is required. Right? So of course, it works on this reconstruction and KL divergence loss. That's why how we calculate the total loss. Right? So once it is done, BAE has generated this image. This is the image which is taken from the program which I have shown you, right? So with all the less number of iterations, this is what we could get. This is the kind of accuracy we could get. But same the counterpart which has to be done for medical imaging, I'm showing you. If I'm able to run the same program with this kind of a data set, then this is what I would generate. So this actually shows me generation of, it's the same, no, it's kind of a lung, right, or the chest X-ray, but the same thing has been done for different findings. There is no finding, which means there is no problem with this patient. There is a problem. He has hernia. You can see that there is a bulge happening. There is a mass, fat, more fat, fibrosis in your lung, right? So all these things, same part, right? But there are so many diagnoses that is happening. So you have to recreate images for every category of the problem, right? So that is how we are going to do, right? So just to give you an idea of how what happens in actual generative AI, right? So VAE learned a continuous structured latent representation. So it's why it was able to generate images, which is very good because the training time was less because it was training in a low dimensional data set and still was able to generate a realistic output, right? So again, this is about VAEs, again auto-regressive models, right? So one very small way of looking at it is, so you have a data and you are trying to decode the data. This is how it is going to come, and there is a generated model which you have similar model which is generated, right? So it again goes through the very similar steps, right? Okay, so we have had the complete discussion, and now it is for us to look at the pros and cons and see the positive side of it and look for opportunities. So what research opportunities I have, right? So what could be my next paper? My next possible paper could be picked up from my opportunities. So what is the challenges I have? Already we have spoken about one ethical challenge, of course, is there. The other challenges for us as researchers is the rapid advancement in technology, right? It is very difficult to stay up to date. That is going to be a biggest challenge. So how can you eradicate that challenge? We can say stay focused and only choose one particular area. Don't have to know everything. You could be master in one, right? So choose one particular area, one kind of say image generation, then stick to image generation and explore more about image generation. So that kind of will eradicate this particular challenge, right? So there is globalization, and our competitors are, when I write a paper, so I can see papers in similar area written from, say, China. You have a paper from US, you have a paper from UK. So our competition is global now, right? So, but how can you sustain that? If you have your idea, right? Then I think you can break that challenge. Idea is yours, right? In the end of the day, you can compete. Doesn't global barrier is not going to be difficult. And there are a lot of demographic changes, changing global circumstances. These are all some of the problems. So this is the perfect time for us to talk about these dynamics, societal dynamics, the dynamics between two countries. So and all that actually changes a lot. Say for example, we don't get that particular infrastructure we already have. We are not able to share. The data set is not any more open. So all these challenges will be there. So you have to face that, and we have to find out solutions. But what is the positive side? Okay. So here you have to look at what it brings. What is the outcome of all this research? It is going to bring a breakthrough in the biotechnology and AI, which improves the quality of life, right? So though we talk about globalization, here I can get access and write to a lot of, say, healthcare data, which is available worldwide, right? So again, you have, world is connected, right? We have new markets are there globally. Now we are also connected globally. Untapped markets, we can look at untapped problems, solve the problems which are not so popular, but still it can change lives, So we will have to pick up such problems. So adapt proactive mindset, continuous learning, foster the innovation and creativity within us, and be committed. Right? That's all we can do to stay in touch with this particular technology. Okay. So as I already told you, I'm going to share some of the project ideas. It could be a project idea, could be a research idea. You can pick it for yourself. Right. So as the ideas keep coming, I can take questions. So any questions, anybody? So what are your thoughts on Gen AI? What do you see in the future? Which was very exciting for you when you read it as an article or a news or a paper? Anything exciting that is happening so that we all also can know?
Dear participants, do you have any questions?